are some different ways to do anterior glide. In fact, Ron even showed me one just a few minutes ago that I haven't actually used in the clinic before, which goes to show there's lots of different ways to do it. So I'll show you a couple different ways, and then I will show you the one Ron did. When you're with me, you're going to be responsible for knowing the ones I taught you, but I'll also show you the one that Ron showed you, just so that way we're all on the same page, okay? So with an anterior glide, we'll get our treatment plane back out, right? So if this is his glenoid, it's facing up like this, right? The anterior glide, we want to go back and in this direction, right? Okay? So remember, posterior glide, we're coming out like this. Anterior glide, we're going back like this. So if he's in this position, let's have you scoot over this way just a little bit. Okay. So one way to do this, and this way, I was just talking to Ron about this actually, this is one of the ways that we were taught in school. One way to do this is to actually, if you're laying supine, you can actually lock down the scapula by putting your hand here on the coracoid process and kind of on the clavicle here, and you're just locking down the scapula from this position and doing your anterior glide. So I'll get my hand in here, supporting, same as we talked about before, supporting his arm here, supporting his elbow. I can give a little traction here, just a little bit, grade 1, right?
Hey Jeremy, why are you doing a little bit of traction?
Okay.
That's important for them to know.
Yeah, and we talked about this a little bit just before. The reason you do it is just to give that little separation between the joint. So if they were having some impingement or whatever the case may be, you're allowing that glide to take place without having any sort. It kind of decompresses the joint. That's the way I have typically described it. Yeah, yeah. So the way we were kind of described with this one, we said fleas knees or breaking bonds or just a little bit. We don't do. It's not a big pulling out like this distraction force when we're doing these mobilizations. It's just allowing enough to kind of decompress and allow that joint to slide more smoothly. Okay. So this is the first way I'll show you. I put my hand here over. I find his acromion here, so I know where it is. I put my hand over his his coracoid region, and then I'm actually doing my glide up anterior like this. Okay. I don't actually love this way of doing this, and this isn't actually the way I would typically do it in the clinic, because you really have to press down in here and lock it down. Some patients, it may not be very comfortable for them, but it is one way that's taught, and this is actually, I think, predominantly the way I was personally taught in school. They showed us some different ways, but the way I was taught and the way I was tested on was kind of putting your hand in here to block down the scapula and just doing your anterior glide out like this. Okay? So, let's have you guys try that one, and then I'll show you a different one.